I've been studying for chronic lymphocytic leukemia in the past 15 years. So we discovered recurrent splicing factor mutation SFB1. So we actually generated the first splicing factor mirror model that can faithful reflecting for CLL disease. So in this meeting, we further dissect how the splicing factor mutation with DNA damage response mutation that can team up and generate genomic instability contribute to the CLL. So my group at City of Hope study RNA splicing dysregulation and oncogenesis. So we feel like this is one area that we need to further understand and to study. Eventually, this could lead to therapeutic target that we can design better therapy to target the RNA splicing dysregulation. From the dissection of the mirror model that carried the SBM mutation, we actually discovered that a splicing factor mutation can induce increased genomic instability through the accumulation of R loop. And when we remove the R loop, we actually can reduce the DNA damage. So we thought this could be one of the key mechanisms that how the splicing factor contribute to the disease. The area that regarding for the RNA splicing dysregulation and CLL will require further dissection of how these different spec variants eventually going to contribute to the disease phenotype, and whether or not we can design an overall RNA splicing factor that can target it and work well for the splicing factor mutation. So I think that's an area that my group is currently trying to investigate, and the whole area that we should emphasize or address. The next step, we're trying to really deep understand the fundamental mechanism for how this splicing factor mutation can be linked to the genomic instability, so through the R loop. So currently my group trying to investigate whether or not the RNA splicing factor mutation can actually involve which step of the DNA damage, whether or not it's involved in the initiation or is involved in the repair. So those are currently undergoing.